when it comes to choosing a fertility clinic, one thing which is not there, which is might be obvious, is that where's the clinic? If you want to save some money, I think we all want to save some money. The cheapest option would be to find a clinic close to where you are and have a surrogate close to where you are. It happened to us the first time, but not the second. So if you're lucky enough to do that, you're going to save yourself a lot of money in terms of traveling from the egg donor to the clinic, from the gestational care to the clinic. We have an embryo transfer and fly back home with the husband. That can be quite costly. So it's one of the things. So in terms of other questions to ask the clinic, well, the sample size, the years in the business, or the reason you mentioned earlier, that's important. But do they have any employees who personally have been involved in this? Because I think I always give it a bit of one when an employee has been herself or just a carrier or a donor, a gay dad as a fertility doctor. These are things that might have some vibes for you. Success rate START, which is the Society of Artificial Reproductive Techniques, and the CDC, the Center for Disease Control, if you look at this website online, they give you some statistics on the success rate of most clinics, not all, but most clinics that are reputable, your success rate of IVF, even segregated for egg donor. Soon we'll have stats. In 2016, I believe, START is going to give stats of success rate with respect to gestational care with an egg donor. Because as I explained earlier, the success rate is actually much better than the general IVF population. Do they have their own egg donors on the site? The more entities you have to deal with, the more costly it's going to be. If you have a fertility clinic with an egg donor bank, this actually makes it, in my opinion, a bit easier. Do they own PGD, CCS, like we discussed earlier, these fancy tests to determine the chromosome status of the embryos, or do they have to send out? Do they allow an embryo for each genetic dad? I won't use the word genetic, it's most biological, because bio is very loosely used, like, for example, a bio motherless bio mother is a genetic mother, or a mother that carries it. So that's a bit vague. So I like to use the term genetic. So do they allow one embryo for each genetic dad? The answer is usually yes. I've never heard of anything that doesn't do it. However, if they strongly push a single embryo transfer, personally I would have some respect for that clinic, because for the reason we discussed, I think this is a direction the rest of the fertility world is going, single embryo transfer. And they have an in-house genetic counselor. We have an in-house psychological support. It's also good. In terms of cost, are the medical fees, is it a flat fee for everything, or is it all add-ons for medication? It's very expensive if you think about it. This medication you give for the surrogate, the embryo transfer, the lab fee for the embryo transfer, try to decipher to get as much transparency as you can. They offer discounts to GPAP. They include the cost of the diagnostics and, as I said, the medication, which is usually in the order of a few $1,000s per egg donor, and quite a lot of money for the surrogate as well. We do the monitoring local. As I said, sometimes you have no choice. If the surrogate is not local, after the embryo transfer, she's going to, most of the time, fly back where she comes from and be monitored remotely. So it's a question they have in touch with somebody, say, like we did from Chicago, where clinic can monitor the surrogate after the transfer. That's a good thing. Frozen embryo transfers, just remember, it doesn't work always the first time. It never worked the first time for me, and I'm fine. Like we said earlier, ultimately, we have such a high success rate, it almost always works. So, so what do we do for Plan B if it doesn't work the first time? What's involved with the frozen embryo transfer? How much does it cost? Is it included? I like the idea personally of baby guarantee, because that you're not nervous financially, like it's going to happen within. Instead of asking yourself, like, remember this, instead of like, okay, I want to be pregnant the first time in the first trial, give yourself a time frame. I want to be pregnant within 6 to 9 months, so you can save yourself a lot of heartache. And I've been there. And we have in Baby's website generic budget checklist that you should look into as well. Finding an egg donor. and then show the button right now. Have a look at everything. So we discussed this earlier, so I'm not going to spend too much time on it. Known or not of this, she goes to the clinic. That's going to save you some expenses. Age is so important. If you're an egg donor who's 31, 31 is a beautiful age. Most of you are probably younger than that or older than that. That's fine. But in terms of an egg donor, there's a huge difference between a donor who's 21 versus 31. Maybe not between 21 and 33, but late 20s or early 20s is a big difference. Medical history, genetic screening, and when it comes to genetic screening, don't be like a philosophy that the more the better. Because we all have some genetic problems, all of us. So if you screen for 250 diseases, which is the standard in some places, you're going to find something. You have to ask yourself, is this reasonable to test for this? There's only 3 genetic diseases I screen from in my office as for the new pregnant patients: cystic fibrosis, Fragile X, and spinal muscular atrophy. The rest is kind of blah. It's just for the patients that like want to believe that everything should be screened for. The truth of the matter, most diseases are probably genetic, but we don't have the answer for most of them. Proven fertility is not important anymore, actually. We used to think that we used to pick an egg donor that had a pregnancy before, whether it's an abortion or a live delivery, but now we don't think it's that important. And availability. Experience with gay dads, I don't think any egg donors can have a problem giving to a gay couple, but you could be surprised. It's important. And in terms of cost, do they ask you for a registration cost, a matching fee? Do they follow the ASRM guidelines? The ASRM, the American Society of Reproductive Medicine, suggests that there's a cap of $10,000 for the egg donor. As you know, it's been in the news lately because some people challenge that. In terms of the ethics, you can have a cap, otherwise it's going to be pushing a woman to lie because they want to become a donor because the money is so high. Shared versus unshared and frozen, we talked about this before. And minimum egg guarantee, that's a good one because, like we said, especially as a first-time donor, nature is what it is. You give X amount of medication, she could produce only 8 eggs or 4 eggs. And that's really not optimal. So if an agency discussed, an egg donor agency discussed that they have a minimum requirement, and if they don't have X number, they'll give you a free donor stimulation cycle, that's actually pretty good. Health, education, adherence. Well, genetics is genetics. Personalities are personalities that are formed after you're born. Age is very obvious, very important, but if you choose an egg donor because of the personality, you could have some surprises after birth because people change a lot. I don't need to say more. Personal statement, essays, photos, videos. There's one thing I regret about my experience about an egg donor is that we didn't have video. I think no one knows how our kids will feel at age 16, 18 about who they want to meet where they're genetically from. If they're nerdy like me, I would have been much more curious about my genetic parents than the person who carried me. But I think a lot of them are curious about who carried them. But if they think it's important, have a little video, a little clip, a 5-minute clip, for me would have been sufficient. That didn't happen. That's okay. The level of genetic screening, we discussed this before, and the willingness to donate to gay men, I mentioned this as well. I don't think any egg donor ever on this. An alternate 2, somebody else on trades. The attorney.
Okay, so I'm going to keep this pretty brief because if you're working with an agency, your agency is most likely going to be coordinating the legal aspects of the journey. If you're doing it independently, you definitely want to make sure that the attorney who you choose to represent your surrogate is licensed in the state where your surrogate lives and or is going to give birth. The agency attorney who's going to be representing you, there will be a choice of laws clause in the contract usually, and they will be licensed in the state where their agency is established. And keep in mind also that the attorney who represents you through the surrogacy experience, the surrogacy agreement, is probably going to be a different attorney who's going to represent you through the establishment of parental rights for the non-biological parent. One of the questions that that you should definitely ask agencies is I have heard that some agencies will sort of advertise the fact that they will have pre-birth orders or post-birth orders for you, and that's going to take care of the parental establishment, and that will save you money in having an adoption when you get back to New York. Unfortunately, the problem that we see in cases like this are when couples split up, and that hasn't been established. So if there is a non-biological parent's rights through a divorce proceeding, the law in New York, unfortunately, is pretty stark. And it doesn't look to intended families unless parental establishment has actually been made. And in New York, the most foolproof way of doing that is through a second or a step-parent adoption. You want to make sure that the attorney who is representing you in the second parent or step-parent adoption is licensed back here in New York, if you're from New York, or wherever your home state is. In some states, you also really want to make sure that they understand the law and they understand the judges, because there are certain states where the judges in one county are more open to adoptions, and in another county they aren't. So if you live in a state, most of those states tend to be in the South. If you're up here in New York, we have guaranteed second and step-parent adoption rights. So I want to, and I apologize for giving that short shrift. If you're interested, more legal details are going to be discussed in the comparative seminar a little bit later on. I also want to open it up after we finish the budgeting and GPAP section for question and answers.
When it comes to the cost, I want to now just go over the various components. I'm not going to get into it, but the most important thing to understand is that when you are starting this process and are looking for, and you want to assess how much this is going to cost you, we have seen from surveys that people tend to underestimate how much this is going to cost them to the tunes of $15,000 to $20,000. Because we have surveys on our website that are for prospective parents, and we have surveys of parents, and we ask them both the question: the prospective parents, how much do you think you're going to be spending, and parents, we ask them, how much did you really spend? So you are likely to be underestimating. Unfortunately, the process works such that there are a lot of things that encourage that. When you go to a surrogacy agency, they don't want to give you the sticker shock. So they might not mention that the surrogate is likely to need uterine lining monitoring. That's another $2,000 or so during the 3 weeks of waiting for the actual transfer. They might not mention, or they might say that they're not sure how much the cost of the travel is for the surrogate and the husband and the egg donor, etc. They don't know some of those issues until you get what's called a match sheet. When there's a particular surrogate being suggested to you, you might not know whether she works or not. So if she works, there's lost wages involved. You might not know if she has small children or not. If she has small children, then there's babysitting fees involved. She may negotiate this or that. You don't know exactly what kind of psychological support package they have for her, or in spa treatment. All those things are things that they may or may not talk about, and they also don't have control over all the third-party costs. So it's built into the system that there's nobody that has the incentive to be the messenger of bad news in the beginning, telling you this is going to cost you more than you think. Some of the reputable agencies would say that, but most wouldn't mind if you find out along the way, because you're already hooked. So I'm not saying they're bad people. I'm just saying it's a structural thing. They don't have the incentive. So that's why we created, and it's in the back of your handout. We created this generic cost estimate or checklist, if you may. You probably will need a magnifying glass and a good glass of wine before you. But we also have, there's a couple of pages there explaining how we arrived at those numbers. Since we have the assistance program, we create a budget for every single couple that goes through the assistance program. And therefore we had to get those cost sheets from agencies and clinics, and we managed to, and then we had to find, and we found in the hard way sometimes, what are the items that are missing there. And we tried to come up with generic and more specific assessment of those. So here in this slide, you see the general components. It's certainly not just the agency fee. It's certainly not just the IVF fee. And if you're interested, come to the 5 o'clock. We'll talk about those things in more details. But let me move forward now to the what perhaps is the easy takeaway from And that is, what if you are cost conscious? First of all, I want to talk about the fact that the cost of your journey is going to be the result of those 3 C's. So it is some things that you can choose. So obviously, you can do your due diligence to find the rates. You can look into the insurance issues, which we'll explain more in the afternoon. There are some more limited options, such as egg sharing and frozen eggs. You need to understand the trade-offs. For instance, if you want a sibling one day in the future, you might not want to limit the number of eggs you're getting to an egg sharing arrangement that gives you only half of the eggs that the egg donor provided. But if you want one child one time, then that might not be a bad idea to save money. As we numerously mentioned, the number of embryos you transfer is up to you, and it has budgetary costs. Could be both ways, but you need to understand them. If one of you versus both of you want to donate sperm, want to be the genetic dad, that has some cost implications as well. It's a little more expensive if both of you want to be the sperm donors. And then there's some circumstances involved. You might be living in a place where there's a great clinic, but where one of you might be HIV positive, which involves sperm washing and sperm testing that cost some extra. Your age might be a little bit of an issue. And then there's the chance. You may or may not succeed in the first attempt. It's very hard to obviously guarantee that. You may or may not transfer twins, in which case you may have twins. That would affect the costs. And your surrogate may have bed rest. One of our GPAP recipients had a child in 32 weeks. It was a singleton. Even for one child, you could be 8 weeks short of full term and still would have additional costs. You might need to stay several weeks away from home near the babies where they're in the NICU, and that might affect the cost, and there's no control of that. As George mentioned, not every geographical concern aspect has the same budgetary implications. Most of you are going to end up living nowhere near where your agency is. The location of the agency is irrelevant, which is why it's so great to have a nice collection of agencies here from all over the country. It does matter where they recruit their surrogates, and to the extent that the agencies recruit surrogates for only their vicinity, then it makes sense, but they don't. Many of the agencies recruit surrogates all over the United States, and not all of them. So the proximity of the donor to the clinic is the most crucial one. If you want to save money, that's the thing I would look into most, because she needs to be monitored very tightly. The more, the further she is from the clinic, it's more costly, and the more moving parts, more likely that a shot is not going to be taken at the right time, a test is not going to be done at the right time, etc., etc. The surrogate proximity to the clinic is also something that you might want to look into. It's going to be less likely. Because by the time you're 4 or 5 months, or even 8 or 9 months waiting for a surrogate, that's one thing you might compromise on, and it's not the end of the world. We've seen 2 people on the panel today that lived close to the surrogate, and it worked very well for them. Most of us who've done this did not, and it still worked. And then the proximity of the surrogate to the intended parents, as I just mentioned, or to the clinic is something that you might not always be able to have. But if she's not near a major airport, that might be actually very consequential. So she might be living in Texas, close to Dallas. One thing, she might be living in Texas 2.5 hours driving distance from or 3 or more from the airport. That might have more consequences. And then as far as the compensation level is concerned, we spoke about the ASRM limits for donors. We talked about the fact that, or maybe we didn't mention that experienced donors, those that have proven fertility, might sometimes ask for more money, still until not more than $10,000. Some people think it's worthwhile. George said he's not sure about that, but there are only so many ways to know how successful this surrogate is going to be. And one of them is how she did in the previous transfer. And then the surrogate surrogates do get sometimes as much as $5,000 more if they're experienced. That, in my opinion, is completely a waste of money. One reason is that if you might want to do it 2 times, if you want to have a sibling, she's less likely to be available if she already had one surrogacy done before. So you're getting something that's less advantageous. And all surrogates have experience in giving birth. Giving birth to a surrogacy child and to her own child, medically is the same thing. So you're not getting something that is more, medically, advantageous just by virtue of her having had surrogacy pregnancies before, but you will be paying yearly for that.